Over the past 2 years, Forefront has been working with both facilities and providers to arrive at our current program of care that we call the 8-week program. Our most successful care delivery has occurred when we work with staff to get all of their residents who are taking any type of psychotropic medication and get those folks screened by a psychiatrist during the first 8 weeks after installation of our Forefront TeleCare conferencing system. In doing so, both providers and staff establish a trust relationship. Providers get an opportunity to meet, assess, diagnose, and effectively treat residents. The 8-week period enables our providers to gain a solid understanding of the care needs of every one of these residents and to anticipate future needs. Staff is able to rely upon access to regular, timely psychiatric support, utilizing telehealth's most important clinical advantage, weekly access to providers. And most importantly, providers are able to give attending physicians and directors of nursing feedback on their care plans and provide input and advice on alternative non-pharmacologic therapies and make recommendations for ongoing psychiatric medication management follow-up sessions and identification of residents for gradual dose reductions. We begin with a staff effort to identify all the clinically indicated patients eligible for this program and begin the process of gaining the referrals from each resident's attending physician that will be needed. As we review each patient's face sheet for qualification for our providers, we enter their names and patient data into our scheduler to make weekly appointments easy. Once we have the count of residents, we determine how many provider hours will be needed to get everyone screened during the first 8 weeks. Clinical experience has taught us the 8 weeks is optimum for developing a solid assessment, initiating treatment, and beginning a treatment maintenance program. Why 8 weeks? Well, first of all, accurately assessing the needs of residents with multiple medical and psychiatric treatments requires careful consideration. Each treatment plan has to be developed. Medications and non-pharmacologic interventions require time to be evaluated and fine-tuned. Second, this time frame provides facility staff an easier transition from previous experiences with typically once-a-month provider visits, thereby working the weekly sessions into their activities with a minimum of impact on their daily operations. These initial screening assessments take between 30 and 60 minutes. For instance, if there are 40 residents in the building, participating in this program, we'll need to see 5 residents per week. That process will take 3 to 5 hours of provider time each week. With each succeeding week, we add a little bit more time to accommodate patients that need to be seen again out of the prior week's screenings. Typically, we will have a portion of the residents that only need to be seen once a quarter, coincident with your PHQ-9 surveys for MDS 3.0. Most will likely need to be seen monthly to monitor their continued use of these medications, and the few that are going through a GDR or who have complicated medical, psychiatric, or pharmacologic regimens may need to be seen weekly until staff and attending physicians are okay with those patients' health status or until the next GDR implementation stage. Coming out of the 8-week program, we will then arrive at a recurring set time block that we'll need to handle the medication management portion of the program. Medication evaluation follow-up sessions may take between 10 and 30 minutes, each depending on the needs of the patient. Again, in my 40 resident example, this process will typically end up with around 2 to 3 hours per week of set time for the psychiatrist to see around 8 residents per week. Again, spreading the workload out enables the providers to see everyone on these meds, including dementia residents. And it also leaves time and access for new residents who need to be assessed within their first few days and to be there to respond to emergencies. With this 8-week program, we have significantly reduced admissions to regional hospital psych ward merry-go-round that you've been on. Today, these facilities have fewer and fewer beds for your residents, and in most cases won't even take dementia residents anymore. So smoothing out the availability of access to behavioral specialists also smooths out the highs and lows related to managing these residents and dramatically improves the quality of life for staff and for the entire resident population. Ours is an integrated care team approach to behavioral care. Our providers want to become a member of your team and help you to manage this very difficult population with non-pharmacological methods whenever possible. I hope you give us a chance to show you what a difference this approach can make.
As Clinical Research Director at Forefront TeleCare, I want to support everything that you just heard about our 8-week program and the clinical advantage it will give your staff in dealing with your residents on psychotropic medications, as well as those who are not on medications, but who pose challenges to your daily care team. The most important elements of the 8-week program are providing the time necessary for complete and accurate assessments and diagnoses of each resident, as well as effective follow-through and maintenance. Staff engagement in the entire spectrum of behavioral care is critically important. The weekly routine is very important in establishing not only a medically appropriate evaluation of each resident in the program to ensure medications and other treatments are being successful. The weekly clinical visits provide a consistent line of communication with the providers. Then the weekly access enables providers to be totally engaged throughout any GDR process to support and coach the staff with non-pharmacologic strategies as appropriate. This program really does work to everyone's benefit with a minimum amount of impact on facility routines so that everyone, not only on psychotropic medications, but with other neuropsychiatric problems, gets the best and most comprehensive care possible.